Hi, folks. Today is Monday, July 20th, and a few updates for you. Number one, the Department of Public Health has changed its guidance related to travel and quarantining. So effective immediately, if you are to travel outside of the New England states, no matter how, irrespective of your mode of travel, so it doesn't matter if it's your personal vehicle or public transportation, if you travel outside of the New England states, you need to quarantine at home for 14 days when you return. So that relates to all of us. It relates to our staff. It relates to you. And so my guidance there is don't travel outside the New England states unless you really, 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 really need to. Just isn't worth it. Right now, our region is doing the best, about the best in the country. And New Hampshire's doing really well. Our average case counts per day went from about 70 in the beginning of June to about 40 in the middle of June, and we've been running under 30 and averaging somewhere about 23, 24, 25 for the last month. So that's great. And that's what the state wants to continue. We want to continue seeing that decline in average new case counts. And the only way to do that is to really not mix with other states and other regions. So stay local. The second part of that is if you have a second home and you have folks who are going to come visit you, family or friends, if they're coming from outside of New England, they also need to quarantine for 14 days. So things to think about if you're here on campus in any of our communities, or even if you're at your second home or you're on vacation somewhere. The second part is you can't test out of this quarantine. So this is the state saying you need to quarantine for 14 days, and that's what it will take. It's not, you can't take a test on day 5, be negative, and get out of that. So I understand that may mess with some vacation plans. This is, I think, good guidance from the state. This is understanding that our region is doing well. We want to try to stay, as we talked about in the early parts of the spring, we want to stay as much of a bubble as we can and stay away from other active cases. So with that, sort of the update, the other thing I want to just talk about is testing. As you know, we actively test. Birch Hill gets tested. Their health center gets tested every Thursday by the National Guard because they're considered outbreak status. And as of last Thursday, we were 100% negative in our testing. So that's 100% of the healthcare staff and all of the healthcare residents who hadn't previously tested positive. If it is negative, if we're 100% negative again this week, then we'll be out of outbreak status and into surveillance. RiverWoods Exeter is in surveillance mode. That's where we test 100% of the healthcare staff and then 10% of the healthcare residents. And they also tested last week. We've not gotten all of those results back yet, but a little more than a third are back, and all of those are negative. So we're doing well here locally. We're doing well. Manchester's down to 60 cases. The Seacoast, even with the summer, we were concerned that the 4th of July we'd see an explosion of cases with visitors and with barbecues and cookouts and such. That hasn't happened. It's stayed very stable since it actually declined since the beginning of July. And we're now 2 weeks past the 4th of July timeframe. So those are all really good things. We just need to continue that. And the way we continue that is maintain your social distance, 6 feet distance, wash your hands as diligently as you can, and wear your mask when you're outside of your apartment, when you're within, when there's even a chance you could be within 6 feet of someone, wear your mask. And that's, those are the best things we can do to keep ourselves healthy, to keep our friends and neighbors healthy, and to keep our communities healthy. So with that, say wash your hands and stay healthy, my friends.